You ready, Mike?
Yep.
Let's see what happens.
Yep, that's all we can do. Run with what we brought to the track.
That's right. All right, here we go. Let's start over here.
And now for something special. The unit is self-contained with its own saddler, farrier, wheelwright and so on. It's a rigorous training dished out who know all there is to know about horses, and it brings results.
We take you behind the scenes now to show just some of the interesting aspects of this training.
Welcome back to Equine Dynamics with Mike Stine, the award-winning #1 podcast to create sounder horses from the ground up. Mike Stine is a registered journeyman farrier with an APF 1 accreditation. This week's show, Season 13, Episode 1, we have Dr. Fred Faragalla. I'm going to mess this up. Faragalla? I'm going to say it that way. Faragalla. He's an equine dentist, and he's going to go over reducing colic through the horse's teeth, performance comfort of the teeth of a horse, and reducing a feed bill, believe it or not, using the teeth of the horse as well. And my very own, reducing everything all at once over my far inside is Mike Stine. How are you?
I'm doing good, Travis. How are you doing?
I'm doing well. So, Season 13, Episode 1, Mike, what do you think?
I think...
Do you remember how to do this?
No. I slept last night, so, you know.
So you've been really, really busy this past couple weeks. Now, we take a couple weeks off, and hopefully everyone has got caught up on the last 12 seasons of shows that we've been doing here. And this right now, we're starting to get in the tail end of June. Now, we broadcast just outside of Charlotte, North Carolina, a little town called Marshville. And we are getting right into the peak of our heat season.
Oh, yeah.
And right now, we were watching the weather report this past weekend. The heat index that we're going to have here in the next 7 days or so, a heat index of 105 on average for the next 7 days, Mike. So, Mike, you're out there, and I know if you're watching this here on the YouTube video, go to Equine Dynamics Mike Stine over on YouTube. Mike, you have a polo shirt on, or a button-up shirt.
Right.
And then under that, you've got like a regular T-shirt, and you wear jeans. Now,
And I got an apron over top of the jeans.
And then you got an apron, not only an apron,
and
but
this the top shirt will come off.
Okay, yeah. You only wear it because you got the logo on there. But not only is it an apron, but it's one of those almost like a welding apron where it's really, really heavy duty leather type. It's heavy for the most part. How are you dealing with the heat, or how will you be dealing with the heat here in the next coming days?
Well, a lot of times I can have a fan running, a little bit of air moving really helps. We'll have a cooler full of water and do the best you can to just keep moving forward, right?
Do you feel that, you lose more weight this time of year just in water weight?
I wish.
I wish I would too. Now, don't forget, you can join the podcast at any time. And the way you do that is go over to equinedynamics.com. At the top of the page says join the podcast. You can ask Mike Stine a question at any time. Your physical voice can be heard during the podcast. You can ask him anything over the last 4 years of shows that we've been doing here. And make sure if you have a question about, let's say, Season 2, Episode 4, make sure you include that in your voice message. Comes over our inbox, and we'll play your voice right here alongside of us here on the program. All right, guys, we got a lot to talk about, lots to get into. And coming up here on the next break, we're going to have Dr. Fred Faragalla. I said it right that time. An equine dentist. He's actually on site or on scene right now, and we'll talk to him about what he's got going on. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Dr. Fred.
Travis, I'm not a dentist. I'm a licensed veterinarian with a special interest in dentistry.
Okay, hold on.
So,
I will fix that.
Okay.
Say that to me one more time.
I'm a licensed veterinarian that has had a special interest in equine dentistry for over 30 years.
Okay. Veterinarian with a special interest in dental for the last 30 years. See, this is the kind of information that needs to be transferred over, and so I just kind of go with.
I understand.
I kind of go with what I got.
I understand.
All right, Mike, you ready?
Yes, sir.
Dr. Fred, are you ready?
Yes, sir.
Here we go. Oh, I got to fix this real quick. 1, 2, 3. 1, 2, 3. And let's switch over the screen and go one.
And I have a brochure in front of me, one of my brochures. It's kind of the what, why, who, when of dentistry.
Okay.
It's the salient point, and maybe if you'll allow me, we'll just discuss that.
Sure, by all means.
Off of that.
Yes,
Right.
by all means. This is your stage, so whatever you want to talk about, we'll let you lead the reins. Pardon the pun on that.
Maybe you can ask me, what is equine dentistry? Why equine dentistry? Who does equine dentistry? When should equine dentistry be done? And then I can fill that in.
Sounds good. We'll do it that way.
All right.
All right, here we go. I got some peach cobbler in the house, Mike, if you want some peach cobbler. My family brought it over. Here we go. Welcome back to Equine Dynamics with Mike Stine. Don't forget to follow us over on YouTube. The way you do that is go over to Equine Dynamics Mike Stine over on YouTube. For every podcast that we do, you can see the full-length podcast over on the YouTube channel. You can see all the humps and the bumps that happens during the program in real time as it happens here on the show. So go to Equine Dynamics. Give them a like and subscribe over there. Coming up on over 3,000 subscribers over there, and all the videos are getting really, really good views. And a very good view from my standpoint right here. Over to my far hand side is Mike Stine. How are you?
I'm doing good. And how are you, Dr. Fred?
You're excellent.
And joining us on the show this week, and I've been corrected, he is a licensed veterinarian who specializes in with a dental interest for the last 30 years. And joining us on the show this week is Dr. Fred Faragalla. Am I saying that correctly?
You are.
Awesome. Well, we appreciate you joining us. I know I can hear it on your voice that you're on site, on location right now. So where are you located right now?
I'm in central North Carolina right now on a farm. I've already done 2 cases this morning, started at 6 o'clock this morning, and I have a full day here and a full couple other days in the area.
Where do you call home?
In Vance County, North Carolina.
Okay, and what's the farthest away that you travel to do what you do?
I used to be licensed in Virginia, Kentucky. I'm still licensed in Florida.
Now, I was born and raised in Florida, so, to get down there, I know it's quite a trip. So I started the show off saying that you're an equine dentist, and during the break, you corrected me. You're like, I'm not an equine dentist. I'm a veterinarian that has a special interest in equine dentistry. Am I saying that correct?
We are, and this is semantics for regulatory purposes.
Sure, yeah. So tell me, what exactly is dentistry for equines? I was talking, like I said, I've got family members up here from Franklin, North Carolina, and they were asking me, they had no idea that horses' teeth need to be taken care of as far as like floating the teeth and scrubbing them and all that stuff. They're like going, well, they're horses. You don't need to. It's like we don't think about doing like dogs' teeth all the time. You just throw in one of those little milk bones that's got the toothbrush already built into the milk bone to keep the dog's teeth clean. When we think of horses, like I said, my family members had no idea that we need to take care of the horse's teeth. So explain to me what the equine dentistry actually is for a horse, for the commoners like me out there.
All right, let me give you some background. Horses typically graze 20 hours a day, and they're out in the wild, and there's a lot of abrasion in the normal environment. We've taken these horses away from the wild and put them in stalls, feeding them very nicely made feeds and hay with less coarse material. Horses' teeth grow until, depending on the breed, until about age 7. They erupt out of the bone about a quarter inch a year until they're about 20. And they're in constant occlusion, and there's constant wear. There's constant attrition of the tooth. There's tooth loss, normal tooth loss. However, horses chew not so much in a side-to-side motion. It's more an elliptical motion. And because the upper teeth are wider than the lower teeth, and the upper teeth are further out than the mandible's a lot narrower than the maxillary bone, there's not good occlusion. And what normally happens is the inside edges of the lower teeth, the lingual edge of the lower teeth, and the cheek teeth, the outer edge of the cheek teeth, they don't wear, so they continue to erupt and they get very sharp and cause dental points. And this is what causes soft tissue trauma in the cheek of the mouth and the tongue. And floating, which I term molar adjustment, is the reduction of these sharp enamel points. It does two things. It makes the side-to-side or the elliptical motion work better. The range of motion of the jaw is more efficient, and you're reducing causes of sores in the mouth. This is the primary focus. Now, we have protuberant teeth, broken teeth, fractured teeth. There's oral cancers. There's dental cancers. There's a litany of other oral dental conditions that I deal with. But the primary maintenance is molar adjustment, is to reduce the sharp edges, to make the lateral excursion more efficient. They can grind their feed more efficiently. They can digest more efficiently, and you reduce the chances of gastrointestinal upset, which is why I got involved in dentistry to begin with. I thought I was going to become an equine colic surgeon, and I was fortunate to scrub in on colics as a first-year student and followed them through the clinic for many years, went to Kentucky and did surgeries, and realized the horses were not meant to be unzipped. They do not do well short-term, long-term for colic surgery, in my opinion. Now, all this has improved over the last 30 years. But why do horses colic? 80% of the horses that I have seen in practice colic because of poor digestion. And by increasing the ability for them to masticate, you're making the particles more smaller. The enzymes can use them more efficiently. The horses are more efficient feed utilizers. The utilization of feedstuffs is improved.
Dr. Fred, I have a question for you. You were talking about colic and what the horses eat. Is there a difference between what type of hay, like, if you've got a level 3 hay as to a level type 4 hay? I don't know if you know the scales as far as how they measure, the potency of the hay. Can the hay itself determine if a horse is going to colic, or is it based on their teeth, like you were explaining how they masticate their food?
Let's not. That's a whole.
Okay, I'm sorry. I didn't mean to throw that at you there.
If the machinery is working properly, horses can use most feedstuffs in a good way.
Okay, and one of the things I always thought because we have a couple horses here on my property here, my wife does, and when I hear that they're floating the teeth, I always thought in my mind that just the horse's teeth all together, all around, were getting too long. Like you've seen the old cartoons of like Jerry Lewis, the old character of Jerry Lewis. He's got these big old chompers, and that's the way I picture a horse's teeth. They get too big for the horse's mouth. But what you're telling me is there's actual bones, like spurs or spikes that are shooting off of the horse's teeth that you're filing down to keep them to where they're not poking into their jaw.
I wish the images that came through. We just get sharp enamel points on the sides of the teeth. That's primary. Now, there are horses that have overlong teeth or protuberant teeth that it's usually the first upper cheek tooth, which is PM2 or an O6, and the last lower molar tooth, which is an 11. They get ramps on the back of those and get hooks on the O6s, and those inhibit lateral excursion. They can actually puncture the opposing tissues. There is a case, and I had a case published, where the teeth on the back can get so long. Now, this is a zebra case where they can damage the internal carotid arteries and we had a horse in Kentucky bleed out 35 years ago. I am seeing less protuberant teeth over the last 30 years as we're more aware of dentistry, equine dentistry, and there are more providers of equine dentistry. The protuberant teeth are I'm seeing less cases.
All right, we're going to take a quick little break, and when we come back, we're going to dive into more of those Dr. Fred Faragalla about what he's seeing out there in the world today as far as the horse's teeth and the traditions that are going on. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. You're doing awesome, Dr. Fred.
Okay.
Dr. Fred is awesome.
I'm getting off track, though.
No, that's okay. You can go off track, you can go on track. It's the information that we need the most, and you're doing awesome. You're giving me a lot of information, and bear with me if I sound like a simpleton. I am, Dr. Fred. I'm the simpleton.
Well, I wish the images came through.
I know. I wish too.
Well, there is a big difference between a Dr. Fred and what a lot of people appear as equine dentist,
right?
Because he can do stuff that the ones that are just teeth floaters can.
All right. Do you want to talk about that, Dr. Fred?
No.
No. Okay. Screw that. We'll talk about something else. When we come back, what do you want to talk about? What do you want to drive to?
Let me go through this. Let me go through this flyer, and then we can expand. You can go off on a side tangent.
Okay. All right. So give me 1 second, and we'll bring you to the back. Okay.
Okay.
You ready, Mike? Welcome
Yes,
back to Equine Dynamics with Mike Stine. Don't forget, you can follow him over on Facebook. That's Equine Dynamics Mike Stine over on Facebook. And we on the phone with us right now, we have Dr. Fred Faragalla, who's going to, he sent me some email pictures. They haven't come through yet, but we're going to post them up over on the Mike Stine Facebook page so you can see all the stuff that Mike's talking, or Dr. Fred's talking about. And over to my far hand side, my very own favorite person in the world is Mike Stine. How are you?
I'm doing good. That's just because I give you money.
And also joining us here on the phone in the studio is Dr. Fred Faragalla, who's out doing horses right now as we speak. Thank you very much for joining us this week.
Great.
So continue what you were talking about as far as, the horse's teeth and reducing colic in the horse.
All right. Let me say two things. It's going to be extremely hot. You've discussed that. If there's one thing we can do for our horses is make sure they get regular salt, a tablespoon to 2 tablespoons of regular salt, and have fresh, clean water available at all times.
Now, I've got an automatic waterer out there. Now, my wife does go out there and get like the grass clippings or hay clippings. If we've got a storm that comes through, she gets those off the top. But inside the water trough itself, sometimes it gets, a little bit of algae down at the bottom. Is that okay for the horse, even though the rest of the water's kind of crystal clear through?
If you would stick your head in it and drink out of it, it'll be fine.
Okay. All right. So I guess what you're saying is just keep an eye on those water troughs.
Yeah.
Okay.
Yeah. Make sure there's not a dead rodent in it, not a foreign body, not manure, not. If it's clean enough for you to drink, it's clean and enough for the horse to drink.
I always go ahead.
Okay. Let's get back on this dentistry. What is equine dentistry? In my idea, it's the correction of dental conditions based on complete and a thorough dental exam. Now, a dental exam, we can do a barehanded dental exam. I do this often, and it's a precursor to what I do later. But a full dental exam involves sedation, a good dental speculum, and a good headlight. You've got to look in the horse's mouth. You've got to touch every tooth, including the last tooth in the head. If you don't palpate the last tooth, you have not done a complete dental exam. Okay, so a thorough dental exam using the indicated instrumentation in concert with appropriate medicinal and pharmacological support. Sedation. We need to be safe. We need to be safe for the horse. We need to be safe for ourselves. We need to be safe for the client. We're using a lot of sophisticated instruments, and we don't want that damage. We don't want the horse damage, and we don't want to become damaged ourselves. Why equine dentistry? Is to reduce and eliminate the sharp dental formations. Now, we discussed this, that normally occur in all equine. I've done a lot of nutrition work. I've done a lot of biochemical enzyme studies as an undergraduate, and dentistry enhances the digestive actions on feed and forage, which maximizes feed efficiency, and I have been told reduces feed costs. I had a 100-mare brood farm in Kentucky, and they told me that I positively affected their feed bill. I had reduced their feed bill by improving digestion.
It's going to make a big difference in how they utilize their feed as far as what they're actually getting out of it in the end.
It's just like an old Ford truck. If the carburetor's out of whack, the truck will work beautifully, and you'll actually pump fuel out the tailpipe. And horses are the same way. They'll just pump out undigested grain, and, they'll go about their business. So it takes more pounds to get your miles per gallon, so to speak.
Right, yeah, to keep the horse running. Now, actually, one of the questions that one of my relatives, like I said, visiting us here this past weekend, we were talking about floating teeth. What do the horses do, like in the wild, and the Mustangs in Colorado and all that? How do they keep their teeth, outside of, rubbing them on rocks or something like that? Is there something that a wild stallion out there does to prevent the stuff that we're doing because we're domesticating them?
Exactly, Travis. They are browsing 23 hours a day on poor forage. And there's a lot of silica. There's a lot of abrasion in their normal diet. So they are constantly being exposed to abrasives that are wearing their teeth. Pasture horses usually require my services less than a show horse or a stabled horse. So the more exposure they have to pasture, and the more pasture that's like desert-like, the more abrasion that's in their diet. Now, I have had horses come from these environments, and the horses are like razor sharp. You'll slice your hand when you stick it in there.
Right. Well, I know
these horses don't, and the fittest survive in the wild.
Go ahead, Mike. What were you going to say?
Well, I know from dealing with the Mustangs that I've dealt with, they'll eat stuff that these domestic horses wouldn't touch, and they're happy about it, and it's good stuff to them, So it's like I tell them, a Mustang I got now, he could survive on a pile of sticks, and he'd be fine.
Okay, so we want to enhance the digestive actions on feed and forage, which maximizes feed efficiency. Now, where does colic come into this? The horse's gut is like a funnel, and as you go back down the funnel, the gut gets smaller and smaller. Well, large particles, and this is primarily STEMI haze or STEMI forage, they can get trapped because they're not broken down in the mouth, and they can cause blockages or start to cause a blockage, start to become painful. This is in the winter. They don't want to drink cold water, so now you're adding dehydration onto an impaction. And then when they get painful and get gas ahead of the impaction is when they go down and roll and twist the gut. So I don't want to talk about colic because I can do that too, but we need to enhance the particle size, reduce the particle size as it goes down the gut so it's more efficient, so it doesn't create a clog.
Not to be too graphic, but I've got relatives all over this planet. A relative up north says, when I eat corn, and then he kind of turns around and goes, well, I went to the bathroom and it looks like I need to chew my corn up a little bit more type deal. You know what I mean?
Exactly. Perfect. Perfect.
I mean, I'm trying to break it down to the simple people out there so they understand.
I understand. So, and I want to reduce and prevent the formation of painful oral, soft tissues, ulcers, and erosions. Now, this happens on the cheeks. This happens on the sides of the tongue. This is so important for our dressage people that are asking the horses to go in frame and be collected. This is so important for horses that are asked to turn quickly, such as cutting horses, barrel horses, reining horses. All horses need this, but the more we ask of our horse to perform, the more important it is that their mouth is in good working order.
And not only that, I mean, the horse has a bit in its mouth. And, you put the bit in the horse's mouth and you sit there and wait for the horse to get it positioned correctly. So if you've got these spurs, these stalagmites and stalactites shooting out of the horse's mouth, it's not going to sit in there right. It's not going to do its job in order to direct the horse where it needs to go.
Well, that
can be part of it. Now,
go ahead.
The freedom of the move.
When they have sores and ulcers, This is especially important, I feel, in the wintertime when the water's cold. It reduces their water consumption because have you ever drunken water and consumed water with a sore in your mouth? It's painful.
It is painful.
And that adds to the colic. That just adds to the colic and reduces water intake.
Mike, you were going to say something?
Yeah, I know that. Last session we had a little discussion about performance of horses because of a discussion I had with somebody over reining horses in particular, and the side-to-side movement of the jaw needs to be equal so the horse can maneuver from left to right equally as easy.
That's how Mike and I met. We met each other about 15 years ago at a veterinary farrier meeting, and we immediately developed this conversation. There is an article in the Farrier's Journal, I don't know when, that talks about dentition and the way a horse goes. And this is the ultimate of what I'm trying to do, is try to promote rider harmony through improved dental health and bridle comfort, which you just mentioned.
All right. Go ahead.
Okay, so, and sometimes we have to treat overlong, problematic, or diseased teeth, which is these long teeth that need reductions. And we don't do the reductions in one visit. These didn't happen overnight. We can make them go away overnight, but that's improper. We need to do this in a staged fashion to maintain overall good health and function. Who needs dental care? All horses, ponies, mules, and donkeys. They all need it.
All right, guys, we're going to take a quick little break, and when we come back, we're going to dive into a little bit more of Dr. Fred Faragalla's knowledge and such interesting conversation that he has. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. Awesome. Are you still good for another segment?
Yep.
Okay.
I've got more to talk about.
Okay. What do you want to talk about when we come back? He's got a whole book full of stuff.
Well, he has multiple books.
Yes.
a lot of books.
So what do you...
I actually have a book of 29 short stories published.
All right, so what we're going to do is we're going to do a segment here, and then the very last segment of the show, I want you to talk about your books, okay? That way you can kind of sell the public and our listeners and stuff and kind of drive them towards your stuff there.
Let me go through this. I still have about a half a page on this brochure.
All right, well, when we come back, we'll dive into that, okay?
Okay.
Mike, you ready?
Yes.
Here we go. Welcome back to Equine Dynamics with Mike Stine. Don't forget, if you have a question for Mike Stine and you don't want to come with us on the air, that's fine. A lot of people don't want to hear their voice. They're like, I've got a shy little voice. Well, you can email Mike at any time. Go to equinedynamics.com. At the very top of the page says Contact Us. Fill out that little form. Ask Mike Stine a question. And make sure you put a physical return address in there. And if you do that, we'll send you out some swag. We got our new logo up and running. We got some new stickers, some magnets. If I can find them around the house. I misplaced them somewhere. But they're here around the house. I'll send those out to you. Make sure you put a physical return address and we'll mail those out to you. And over to my far end side, still roaming around my house, is Mike Stine. How are you?
I'm doing good, Travis. How are you? And glad to have you with us, Fred.
Thank you, Mike.
And joining us this week on the show is Dr. Fred Faragalla. He is a veterinarian who specializes in the interest of equine dentistry. He's joining us here on the show. So you want to talk a little bit more about what's going on out there and what you're seeing in the horses community right now.
Right. So an answer I always get is, when should equine dental care occur? Annually for all patients, more frequently on a case-by-case basis. Now, I like to see my horses, my patients, every 12 to 16 months that are in normal use. Performance horses maybe more frequently. Horses with pathology, I call these works in progress, reducing these overlong protuberant teeth every 6 months for several visits. The last 25 years, there's been a resurgence in the interest of this almost forgotten art form and frequently dismissed area of fundamental horse health. But as man has appreciated new technologies and methodologies in modern times, so have our equine patients. I use custom instrumentation. Some of it I've developed, some of it I've modified. There have been great forward progress in dentistry. There's a picture of an old German flatbed railroad car with motorized dental equipment going back to World War One. So mechanized dentistry in horses is nothing new. We've just refined it, and I've taken it to even a higher level. Much confusion and debate exists today in the equine community as to which procedures and technologies are more appropriate. There's infighting among several of us as which procedures are indicated, and we still haven't sorted certain procedures out.
Well, that's kind of true.
Sort all this out, one needs a lifelong understanding and appreciation of the equine patient, both inside and out.
Go ahead, Mike. Mike was going to say something real quick.
That is true through the hoof care industry, end of it, and everything else. And, anything that affects movement patterns of a horse, like if you've got a horse that can't collect, it impacts their feet directly. And I don't know how much difference it would make on Fred ends whether a horse's feet were functioning like they should or not, but I know on my end, if they cannot move correctly, it definitely impacts hoof growth patterns, soundness, and everything else.
I have seen and primarily got into dentistry for the digestion, and the behavior and the way of going was an asset, or was an unexpected, pleasant finding, as far as people saying my horse is going a lot smoother, my horse has power steering in the mouth, I'm not getting the resistance. So this goes with, what both Mike and I are trying to accomplish, is to make the horse more efficient, more comfortable, more limber, more prone to move in easier ways, as an athlete should. My goal is to reduce the hindrances in the mouth that would affect a horse's way of going.
Right. There was a horse recently that I've been working on for some time that she always had a look on her face, let's say that. But they finally had someone come in, work on teeth, and apparently the mare had a bad tooth in the back, and they took it out. And boy, her disposition has totally changed. She was never hard to work around, but she always gave you that look, and she has changed. It's like, well, this is just the way the mare is. She was hurting, and nobody had looked that far.
Yep. And I know from riding horses personally, I know my horse, he felt much more comfortable after I worked on his teeth. And it's a pleasure to ride a horse that's very comfortable and very responsive and very supple. I mean, you ride him on a loose rein, which I feel a lot of horses should be ridden on. And it's just a joy to know that you've got power steering at your fingertips. But to do this, you have to understand the horse. I grew up with horses. I eat, breathe, and dream horses. So there's a lot of horsemanship involved, and a lifelong understanding and appreciation of the patient, both inside and out. My major tenets in practice are to help all equine and their owners through thorough oral exams, formulate a working diagnosis. What am I going to treat? Why am I going to treat it? Tailor an individual treatment plan and course of action for that patient. It's not cookie cutter. You don't treat every horse the same. You don't give them the same medications. You don't take off the same amount of tooth. Similar pathologies merit similar treatments, but they're not all the same. We all walk differently. We all talk differently. We all chew differently, and horses are no different.
Did you have more on the brochure, or did you finish the brochure?
I think we've kind of discussed.
Did you cover everything?
The goals are to reduce GI upset through enhanced feed forage utilization, eliminate dental sources of oral pain, and addressing TMJ interference. Lessen the severity of malocclusions, preserve the compromised, still viable tooth, That's putting in restorations and fillings and removing the problematic and non-viable tooth, as Mike explained, extracting that tooth, and promote good body condition through weight gains.
Right.
Be kind to the patient and be kind to the owner.
Well, it's cheaper in the long haul to take care of the teeth than to deal with the colic. And we all know the colics can be very devastating. And as far as you're asking your horse to perform, and we're buying this and doing this and all that sort of thing. And if that's the one thing that got me focused was the whole TMJ thing and the movement of the head, and it affects how the body balances and how they move. So for performance issues, and it's just like doing it's really no different than doing regular hoof care in a time where you could stay ahead of problems.
Yes, exactly.
All right, we're going to take one more little break and one more little segment. We'll let you get back to playing with your pony. So stick around. You're listening to Equine Dynamics with Mike Stine. He'll be right back. All right, last segment, and basically we're going to have you just spill your guts about your book or books.
And one more thing. Don't say I specialize. I have a special interest.
Okay, special interest.
I'm not a specialist by law.
Not a specialist. I'll put specialist.
Special interest.
And it's special interests.
You get me before the board and they'll put me in handcuffs.
They don't listen to this program.
Somebody will.
I know somebody will.
Oh, Lord, yeah.
Did you hear that Dr. Fred said he was a specialist? Well, I'm a specialist too, dear. What are you a specialist at? I'm a specialist of sitting here talking to people. Well, you don't have a license. Well, technically I don't, but nonetheless to you, right?
And maybe you can edit out that bit about me going to Virginia, and I don't mean to waive my licensure. Just travel extensively. I have traveled extensively in the past.
Okay, I'll doctor that up. Out the Virginia trip. All right, I got the notes for that. All right, here we go. We're going to talk about your books or talk as much as about the books you want. We're going to keep this segment within anywhere from 5 to 8 minutes. Is that okay? And then we'll turn you loose. All right, here we go. You ready, Mike? Welcome back to Equine Dynamics with Mike Stine. Don't forget, you can join the podcast at any time by going to equinedynamics.com. At the very top of the page says join the podcast. And what that means is your voice can be heard right here alongside of us here in the studio. Your voice comes right to our inbox. We'll play it on the very next podcast. We broadcast every Monday morning at 9 a.m. Eastern Standard Time, just outside of Charlotte, North Carolina, a little town we like to call Marshville. Leave a message for Mike Stine. We'll play your voice here on the air, and we'll answer your voice also, or answer your message right here on the air as well. And my very own on the air tonight, over to my far end side, is Mike Stine. How are you?
I'm doing good, Travis, and thank you for being with us, Dr. Fred.
Yes, sir, Mike.
And joining us this week on the show, we have Dr. Fred Faragalla, who is a veterinarian, equine veterinarian, who has a special interest in horses' teeth and dental care. He's joining us this week. Now you just don't go out there and do horses and do the teeth and stuff. You've been doing this for over 30 years. You have written several books as well.
Now, I've just written one book. It's The Trials and Tribulations of a Large Animal Veterinarian.
Well, you wrote one book and has been printed several times, so let's go it that way, right?
Well, it's just been printed once.
So tell us how you got into the book and what that book is involved with and how people can find it.
Okay, one of my first calls, climbing back in the truck at midnight, I was just shaking my head saying people just aren't going to believe this. So I started writing the book in my head when I first started practice. And over the last 20 years, I started writing it down. And within about 5 years ago, I finally published it. It's 29 short stories of my adventures or misadventures in the large animal world. There is a dog story, finishes up with a dog story. It's primarily horses, cattle. There's a story about an elephant, both production hogs and farm hogs. And it's quite entertaining. and it's an easy read. And if you want to get a copy of it, you need to contact me personally. I haven't put it out for publication with Amazon or any of those.
You're missing, Dr. Fred, you're missing the boat. There's so many people out there that listen to the show that want to get this thing. You need to put it up on the Amazon or somewhere out there.
Well, I don't have that skill set.
Leave it to me. I'll make you a millionaire.
All right.
Well, Mike, you were going to say something?
Yeah. Do you do hog's teeth?
I have cut tusks on boars.
Okay.
It's kind of it's not a glamorous job. It's
Oh,
not
I'm
a
sure.
good job,
I'm sure.
But boars can get huge tusks, and they can cause a lot of damage on their pen mates, pasture mates, and yourself if they get a hold of you with those tusks.
Right. It's about as glorious as trimming pig's feet.
Exactly.
So, Dr. Fred, how can our listeners get a hold of you? You have a phone number? Do you have a website? Do you have an email address? How do people get a hold of you if they want that fabulous book of 29 stories of horses on the road?
The best way is to text. Right now is to text me at 352-274-1740. I did away with modern conveniences. I no longer have an email address. I did away with that about 12 years ago when it became corrupted, and I'm just not into these modern technologies. I'm old school, according to my young clients. So I apologize for that, but it's always worked. I use paper forms. So,
well, we appreciate you stepping out of your comfort zone and joining us here on this very, very digital podcast that broadcasts on over 25 different platforms on over 77 different countries and covering 48% of the United States. So we appreciate you getting out of your little comfort zone, out of your little, what do they call it, a Faraday cage, and joining us here on the show.
Yes.
Thank you for your time, and it was great. It was great to share this information with you and your listeners, and I hope we can help some horses, or somebody will be able to help a horse because of this.
Yeah.
Again, in this hot weather, make sure they have plenty of salt. Table salt would be fine, and clean water. Even if you have salt blocks, by putting salt in their feed, you know they're consuming it, and it's going to make them thirsty, and they will drink. Guys, it's been real. Mike, we'll see you down the road.
Thank you.
Safe.
Yes, sir.
Travis, thank you for your time, and let me get back to these patients.
Well, we appreciate it. On behalf of Mike Stine over there.
Yep, thank you, Dr. Fred, and I've always learned a lot from this man.
All right.
My name is Travis. My name is Travis, and see you next week.
Cheers.
Cheers.
All right, Dr. Fred, we'll let you go. We appreciate it very much. I'd say I'd send you the link to everything, but if you're not very tech savvy, I don't know how you're going to be able to listen back to the show. So
You can still text it to me to this number.
okay, and you'll be able to listen to it on your phone?
I'll try to find a way to get to it.
All right, I'll send you every avenue that we can for the show. So we appreciate you, Dr. Fred. You should see something tomorrow from me with all the links and stuff to the show, okay?
It's just one book, and
What's the name of the book?
it's the trials and tribulations of a large animal veterinarian. Trials and tribulations of a large animal vet.
All right, sounds good.
Veterinarian.
Sounds good. Thank you very much, sir. I'll let you get back to
The title of it is Doc, It Ain't Good. The trials and tribulations of a
I like
large
that.
animal veterinarian.
Doc, It Ain't Good. All right, I got it. Ain't Good is the book's name, title. Got it. And he's gone.